Yes, sir. Greetings of the day, everyone. I'm privileged to welcome you all into the Health Talks series organized by the Student Council of Sadabai Raisuni Women's College, supported by SGR Knowledge Foundation, and powered by Raisuni Group of Institutions. We all know how diabetes is ruining life of many people across. The life of an individual today is so busy that they don't get time for the exercise or say long walks, which is very important for their good healthy life. People are working at their home during or say after COVID by just sitting at one place for hours and continue looking at the screen. This is not good for healthy life. Not only adults, children of 3-4 years are getting diabetic. So to prevent, manage and reverse diabetes, we have Dr. Shrirang Bhurchandi with us. I welcome you, sir.
Thank you.
He is a general physician, lecturer, and fellow resident in geriatric medicine and Jawaharlal Nehru Medical College, Wardha. He also pursued his post-graduation in MD General Medicine, from Jawaharlal Nehru Medical College, Tattamege Institute of Medical and Sciences. He worked for 3 years of residency in Department of Medicine at Jawaharlal Nehru Medical College. He also worked as an assistant professor in Department of Medicine in the same college. He also researched on the topic of impact of hemoglobin levels and outcome in acute coronary syndrome, a study to evaluate incidence of new onset ulcer and ulcer healing time in patients with diabetes mellitus and plantar foot ulcer. Correlation of sarcopenia with modified frailty index as a predictor of adverse outcome in critically in elderly patients. Now, without further ado, I would like to hand over the session to you, sir.
Yes. Thank you for introducing me, Ms. Tanvi. So we shall start the session with what all questions you would like to ask me. So I can answer
No, sir,
in
you
all.
can firstly you can discuss about what you want to say, and then I'll ask you.
Okay, thank you. Diabetes per se is a very vast topic to be discussed in 1 hour, to be honest with you. There are many books written on diabetes, like Bibles of diabetes and all that, with books of thousands and thousands of pages. So to be short, in this time span of 1 hour, diabetes, as we all know, is a very common metabolic condition prevalent in India, and India is supposed to be the capital of diabetes in the next 20 to 30 years. India is going to be the leading country. India still it is now, but it will be the topmost with like almost currently there are 40% people who are diabetic or are pre-diabetic in India as compared to the world population. The reason being that sedentary lifestyle, junk food eating habits, then lack of physical activity, that's including sedentary lifestyle, genetic factors, obesity, and many other prevalent factors which contribute to a patient to become prone to be a diabetic person. So that is in brief about outlook. Then diabetes. What is diabetes? Main question. In medical term, to speak about diabetes, it is a chronic metabolic condition of altered carbohydrate metabolism in which there is hyperglycemia. Hyperglycemia means increased blood glucose level, and altered metabolism means in normal healthy individuals like you and me, when we eat food containing sugars and carbohydrates, it is usually metabolized by the body, utilized, and the sugar level remains normal. But in a person who is either type 1 or type 2 diabetic, there is defect in the metabolism of carbohydrates which he or she consumes by the diet. So there is a hyperglycemia in that person which can manifest in clinical features of diabetes, which you would like to know, like symptoms of hyperglycemia which we see. Like a person might ask, sir, what are the symptoms of diabetes? How would I come to know if I'm diabetes or not? So the symptoms for hyperglycemia, it is indicated as three P's. P. P for first P is polyuria, means excess of urination. When a person is urged to pass excess of urine after drinking water, polyuria. Polydipsia means excess of thirst. Polydipsy. That is, person feels excessive thirsty, feels like drinking lots and lots of water. And polyphagia. Polyphagia means excess of craving for eating food. He is always hungry, and he keeps on eating whatever he gets. So these are the three P's of symptoms of diabetes mellitus. So these are the main clinical features which point that a person is either diabetic or is on the verge of becoming diabetic. So this is the basic outcome of diabetes. In the initial, I'd like to introduce to diabetes. And any questions you have to ask me, or shall I continue?
So you can continue if you want to talk something, discuss something, or
No,
shall I
discuss
ask?
some. Yeah, you can ask the question, because if I keep on talking, it will take our 4 to 5 hours to complete the diabetes.
Okay, sir.
So, because it's a very long topic to be discussed in the time span of 1 hour, so you have specific questions, you can ask me. It will be a counterproductive session, so that the public will come to know,
Okay, sir.
like in general terms. So you can ask the questions, I'll answer them.
Okay, sir. So, firstly, I wanted to ask you that a woman going through her menstrual cycle or say
Mhm.
ongoing menopause will
Mhm.
affect their sugar levels. Like,
No. Mhm.
no. Okay, sir.
There is no correlation or study as far as now related to correlation. There is no study being conducted till now whether the menses or a premenopausal or postmenopausal woman, there is a correlation between diabetes and menstrual cycle. Whether does the menstrual cycle affect diabetes level or diabetes level affect the menstrual cycle? There is no correlation as of now. I mean, I haven't read as of now. There is no any study as such done over the worldwide.
Okay, sir.
Mm-hmm.
As we know, fruit contains some sugar levels, like say carbohydrates and any.
Mm-hmm.
So, what will happen if we eat more fruits? Like some say, eating fruits is healthy for you.
Yes, in the normal non-diabetic person, when you eat foods, we get potassium and saccharin, like other sweetener substances. So that helps in the satiety, satisfying, in muscle building, because fruits contain potassium, rich in potassium, which is good for muscles, muscle strengthening and muscle
Hmm.
building. So in a non-diabetic person, if you're talking eating foods is really healthy. Like there are certain foods we call the term called as glycemic index, that is low, medium, and high. The foods which are having low glycemic index are good for diabetes. Medium glycemic index and high glycemic index containing foods are bad for diabetes. They are kind of contraindicated or not recommended to be consumed by a diabetic person. So
Okay.
depending upon the glycemic index of the food, uh, we can modify our diet and the fruits which so like fruits which are a high glycemic index, like mango, banana. They are
Okay.
high mango, which is specifically which is very high glycemic index food. It is highly not recommended and strongly barred in a patient with diabetes, because it is high glycemic index and can delay the glycemic control of a person. So just for example of using, I'm saying this is high glycemic index food. Mhm.
And sir, how often should a person having diabetes replace
Mhm.
his or her glucometer?
There is no dictum as such that after a particular period of time one should replace the glucometer. There is a solution. If you read the manuals, like there are various companies which manufacture the glucometer, like AccuCheck, One Touch, TrueCheck, and there are many 3 to 4 companies which manufacture the glucometer. So when you buy it for the first time, along with it, you should buy a solution which is provided by the manufacturer and the pharmacist. There is a strip of the glucometer which you insert in the glucometer, and you put the blood drop on that to check the blood glucose values to see the efficacy, and if the glucometer is working properly or not. There is a solution which comes along with the glucometer, which you should put on the glucometer strip, and which uses the exact reading, which is whether the glucometer is working normally or not. So after say maybe 3 to 4 months of use, you should check it once. If it is not exactly showing the reading properly, as you take the reading with your blood glucose value and with the glucometer solution, then you can consult, you can see, you can ask the pharmacist, you can cross check with your doctor whether it's time to change, or whether the glucometer is defective, or if it is time to change to another company glucometer. So there is no as such hard and fast rule that after a certain period of time you should change the glucometer. It depends on how frequently we monitor the blood glucose also. So it's actually a good question, but there is no specific timeline answer to this question that after say 6 months or 1 year or 2 year one should replace the glucometer. But yes, you should check the glucometer sensitivity with the help of the solution which comes along with the glucometer. You can ask the pharmacist; he will guide you according to that. Or even if a doctor who is a consulting physician diabetologist, you can take the recommendation of him or her. That they will definitely tell you how to interpret the readings of the glucometer and when it's time to change the glucometer or not.
So is diabetes reversible? Like,
Yeah, go ahead.
can it be like can it be reversed? Like,
It depends upon which type of diabetes you are talking. There are two types of diabetes to be on the broad term, talking on the broad term, type 1 and type 2. In type 1 diabetes, the primary treatment is we give insulin. And in type 2 diabetes, the primary treatment we give is oral medication that is called as oral anti-diabetic drugs, OADs or OHs. Type 1 diabetes is a autoimmune condition. Autoimmune condition means when our body's own cells, T cells, they act against the own body tissue and they cause beta cells in the pancreas to get destroyed, because of which there is insulin deficiency. This type of diabetes is called as type 1 diabetes, which is not reversible. Whereas if you're talking of type 2 diabetes mellitus, in which there are various predisposing factors like obesity, sedentary lifestyle, family history, wrong eating habits, smoking, alcohol consumption. If all these lifestyle factors and predisposing factors are controlled, type 2 diabetes, if it is in the pre-diabetic range, it can be reversed. But if it is full-blown diabetes, like there is the term called as HbA1c, and that is average sugar of 3 month duration, we test it. If it is highly uncontrolled, then it is less likely that the type 2 diabetes will be reversed. But if it is in the pre-diabetic range, like before diabetes, and between the stage between normal glycemic person and diabetic person, there is a stage called as pre-diabetes, in which their sugar levels are altered, but they are not in the range in which we can term as diabetes. So that term, it is called as pre-diabetes, which is completely reversible if a person takes regular medication, does a lot of exercise, controls over his food, do exercise and lifestyle modification and follow the advice, and that stage is completely reversible. But if the patient is in diagnosed with the type 2 diabetes and if it is uncontrolled, then there are less likely chances that the diabetes will be reversed. But pre-diabetes condition, it's definitely reversible if the person follows the doctor's advice and take precautions.
okay, sir. So what is the normal range? If a person gets diabetes, what is the normal range of that? Like, it should not go above or below that range.
Normal range of sugars, you're asking blood glucose level.
Yes. Yes, sir.
Normal glucose, see, there are three types of blood glucose testing we do. One is random blood glucose, one is post meal, one is fasting, which everyone is aware of. Random blood glucose means it has no relation with the food intake or fasting. Now, random blood glucose, it should be up to 140 milligram per deciliter. 140 or less than that, that is normal. If it is between 140 to 199, then it is called as pre-diabetic. If it is more than 200, then it is called as diabetic. This is random blood sugar. Then post meal, which we say post prandial, that is after 2 hours after having the meal, which we do the sugar level. If it is more than 200 milligram per deciliter, then the person is termed as diabetic. And depends on also on the fasting level. If it is more fasting means how long you should fast. Fasting should be of minimum 8 hours duration. Like if in the night we had our dinner, then suppose at 9 p.m. a person takes his dinner, his or her dinner. Then starting from 9:30 to the morning, 8 hours means till 5:30. You should not eat anything. You should not consume tea, coffee, or anything. At least 8 hours of fasting should be maintained to do the fasting blood glucose level. And if that blood glucose level values exceeds more than 126 milligram per deciliter, then the person is termed to have diabetes. These are the cutoff values which we say to diagnose or label a person as a diabetic.
So how should a person manage if he gets low blood sugar or say high blood sugar? So what should he or she do for
You're asking
managing?
exactly two different ends of the spectrum, low
Yeah.
and high blood sugar. Anyways, I'll answer it. Low blood glucose means the person has a very tight glycemic control, very tight sugar control. He's taking his medication very regularly, and maybe his diabetes is under control, but he has not evaluated, and still he is continuing to take the medicine, because of which he is landing up in hypoglycemia. We call it hypoglycemia, that is low blood glucose level. The signs and symptoms of hypoglycemia include the patient will have shivering, he will have sweating, palpitation, tremors in his hand, like shivering upon in the local language, which we call this hath pere kapna, what we say.
Mm.
That is tremors, shivering, palpitation, heartbeat goes up and down. Then there are medical term, in medical term we call this neuroglycopenic and neurologic symptoms. neurologic and glycopenic symptoms, which you call in the medical term. That confusion starts to occur. It depends upon the patient's blood glucose level also. So these are the clinical signs of hypoglycemia. In such a case, if a person is known diabetic and is taking medications which are prone to make him to go into hypoglycemia, the person should carry Glucon-D powder or two or a pack of biscuit in his or her pocket. And if the person gets the clinical signs of hypoglycemia, he should consume at least 50 grams of the that Glucon-D powder, or have simple carbohydrates like biscuits, or fruity like fruit juices, or the high, or add sugar to the water, lemon sharbat, what we call it as. So these are the basic remedies which one can follow to prevent the damage because of the hypoglycemia. And now talking about hyperglycemia, the symptoms of hyperglycemia, they include symptoms of hyperglycemia, like it is like we discussed about the hypoglycemia. In hyperglycemia, the person has, like we discussed, the three P's: polyuria, polydipsia, polyphagia. It's a very long term sequelae. It is not on a short term that the person will develop all the symptoms. So like the person needs to check his or her sugar at a regular interval to see if she is landing in hyperglycemia or not. Just like I told you, polyuria, that is excess of urination; polydipsia, excess of thirst for drinking water; polyphagia. And if the person is starting to develop complications like of neuropathy, that tingling or numbness, that is sunpana, which we call हाथ पैर में सुनपना आता है, the normal non-medical term which the person describes to you when it comes for the first time of hyperglycemia, that is he or she complains of is having tingling or हाथ पैर में मूंगे आती है. These are the local terms, clinical features. It indicates that the person might be having diabetes. So you have to check the blood glucose, that is blood sugar value, and according to type of diabetes which the person is having, a type 1 or type 2, you have to start the medication. Like for type 1, we go for insulin therapy, and for type 2, depending on the patient's body status and long term and how long the patient has been diabetes, we can start the oral anti-diabetic medications. So these are the ways to control the low and high blood glucose.
Okay, sir. So a person having diabetes, what
Mhm.
all diseases, like what all diseases he can get because of the diabetes,
That's
like
a very
heart.
common. Yeah, yeah.
Yes.
So there are, like, it's a wide spectrum of complications a person of diabetes may encounter in his or her life. The complications broadly classified are micro and macrovascular complications. Macrovascular complications, like major vessel complications, they include heart attack, like heart diseases; stroke, like paralysis, or which we call in the local term stroke; and gangrene or peripheral vascular diseases. That is the disease of the lower, I mean, the legs and the foot, in which the patient may get ulcers over his leg or his sole, or there may be deep vein thrombosis, DVT, gangrene if the disease is untreated. These are the major complications. And minor complications of diabetes can include like retinopathy, disease of the eye, in which the person starts to developing visual disturbances, and he or she may complain of blurring of the vision, like धुंधला धुंधला दिखता है. Kidneys, these are the eye complications. Then kidney complications, like chronic kidney disease, diabetic nephropathy, which is called as, that is the kidney function starts to deteriorate, and the blood parameter, that is serum creatinine, which everyone is aware of nowadays, it starts to rise up, and the person will end up in chronic kidney disease. The treatment for which is hemodialysis, which we all are aware of, that it's a very bad treatment option, that the person may succumb or collapse at time of undergoing the dialysis. Then retinopathy, neuropathy complication, like small fiber, large fiber neuropathies. That is the person may complain of tingling or numbness in knees or hand. So these are the major complications. Then because of high blood glucose level, the person is also prone to develop many infections like sepsis, septicemia, skin infections like contact dermatitis, skin allergies, because the high blood glucose in the body is a food for microorganism. Like we take food, like every day we consume food from carbohydrates, proteins, fat source. Like that, in our body, when the blood glucose is high, the bacteria, they are more prone to feed on the blood glucose which is elevated, because of which they colonize in the body, and they tend to cause a systemic infection like skin infection, dermatitis, and there are various conditions. The list goes on. So these are the major complications and skin and other infections which a diabetic person is prone to develop.
Mm. And sir, lastly, I wanted to ask you what guidelines you would like to tell for for a healthy life for a diabetic person, like.
Mhm. Okay. We'll categorize it to type 1 and type 2 person, and then we can easily summarize it and guideline I can tell you. And if a person is type 1 diabetes and he is on insulin regime for diabetes control, then he or she should regularly check the site of insulin injection, whether it is becoming thick or there is any skin color change. The person should use the syringe, I mean the needle, one syringe only one time. That is the dictum which is to be followed by every type 1 diabetes person. He or she should regularly check at least once or twice a week, should check his or her blood glucose level to see if the insulin dose is adequate or not, so that the person doesn't land up in hypoglycemia, that is low blood glucose level. After that, he or she should monitor or appropriately administer the insulin which he or she is taking for type 1 diabetes. These are the guidelines which are there for type 1 diabetic patient. And then in type 2 diabetic patient, the person should monitor his or her HbA1c at a regular interval. If it is uncontrolled, then you should monitor every 3 monthly. And if it is fairly controlled or optimally controlled, then it can be monitored between 6 months to 1 year. The HbA1, that is average level of sugar, it indicates the glycemic control. Then, depending upon the compliance of the medication, if the patient is taking the medicines regularly before the meal or not, he or she should take the consult a diabetologist or MD medicine or physician at a regular interval. They should get their fasting and postprandial blood glucose to be checked every twice weekly, twice a week. I mean, every after within 2 weeks, they should check their blood glucose level so that the dose of the medication can be adjusted accordingly. Then they should try to do exercise of 30 minutes per day for 5 days a week. That is 150 minutes a week of workout is the most appropriate regime which diabetic person should follow to keep his or her blood glucose under control. And if he or she is having other complications like cardiovascular complication, heart complications, or brain complication, then accordingly the medications he or she should take to prevent the further damage or further loss because diabetes complication. And pertaining type 2 diabetes mellitus diet, like just we starting only we discussed like low glycemic index, intermediate and high glycemic index diet. uh, then if a person is well educated, then I would recommend them to follow the American Diabetes Association guidelines to see what type of foods they can eat and what type of exercise, what complications they are more prone to develop, and how to tackle with them. So these are the basic fundamentals and the basic guidelines which I would recommend for every diabetic person to follow to keep a healthy lifestyle and keep a diabetes under control, which can prevent him from developing the complications.
So will intake of insulin make a person gain his or his weight?
Yes, yes. Insulin is a weight gaining substance because when we inject the insulin in the body, it prevents the lipolysis condition in which there is fat breakdown normal in a person, because of which the person loses his weight. But when we inject insulin in the person, it prevents the lipolysis, because of which there is weight gain in the person. So insulin, it's a very good question. Insulin causes weight gain.
So if a person is diabetic,
Mhm.
will he or she will ever get like free of the diabetes? Like.
Like I had told you in the beginning, it depends upon which type of diabetes we are talking, if type 1 or type 2. Type
Okay.
1, no, the person will have to lifelong take the insulin, and type 2 depends whether if it is pre-diabetic or full-blown diabetic. So, if it is pre-diabetic and the person controls, person takes good care, adequate care of his or her glycemic index and controls his or sugar in the optimal range, then it is very well reversed. But type 2 diabetes depends upon the level of control and the person's awareness toward the diabetes, how he or she is managing the diabetes and their compliance with the medication. These are the points which will decide whether the person's diabetes will be reversed or not. But to some extent, diabetes, type 2 diabetes can be reversed depending upon the patient's compliance towards the medication and lifestyle modification.
Sir, if a person is recently diagnosed by type 2 diabetes,
Mhm.
Is he needed to consult the endocrinologist?
Oh yes, definitely. I mean, they are the superior authority in relation to diabetes. Like it's a bread and butter. But it also depends upon if the patient is having other genetic conditions, like patient is having thyroid disorder, because it's an autoimmune condition which is more commonly associated with type 1 diabetes mellitus. But type 2 diabetes mellitus patients, they're also more prone to develop hypertension because of the hypercholesterolemia, because diabetic persons are more prone to develop like which we called as cholesterol problem, that is hypertriglyceridemia and dyslipidemia, which may which may lead a person to do hypertension also. So if a person consults endocrinologist, it's good. If even if he or she doesn't consult an endocrinologist and goes to a physician, that's also accepted.
Okay, sir. So thank
Thank
you
you.
for your excellent views.
Thank you. Any more questions to be asked?
No, sir. Thank you.
Thank
So
you.
it was a just awesome being with you,
Thank
part
you.
of the session. I once again thank you, sir, and the audience in the form of systems. Thank you, sir.
Thank you.